What's wrong with death, sir? What are we so mortally afraid of? Why can't we treat death with a certain amount of humanity and dignity and decency, and God forbid, maybe even humor? That's a quote from the film Patch Adams. According to CNN.com, the 2018 data summary in Oregon, which was the first state to enact a death with dignity law, showed that 2,217 people were prescribed life-ending medication. And of those, 1,459 people chose to ingest the medication prescribed to them in that year. According to deathwithdignity.org, Death with Dignity allows mentally competent adults who reside in one of the 8 participating states with a confirmed terminal illness and 6 months or fewer to live to request prescription medications to hasten their inevitable death. These laws provide dignity, control, and peace of mind during their final days. I've personally held the hands of many dying people over the 3 years that I've been a nurse. I've cried, laughed, and mourned with their loved ones. Dying is never easy. It can be scary, painful, and very undignified. If we could offer these end-of-life measures in our state, I believe that we could better support our loved ones and hold a whole new appreciation for end of life and all that it entails. The main things to know about Death with Dignity is that it gives people autonomy over their life during a time when they feel especially helpless. With the help of Death with Dignity Act, physicians are able to assist patients in experiencing a painless and less traumatic death. Most importantly, death with dignity is not suicide or murder. During the end of life, people can really feel helpless. Their bodies begin to not work the same way that they used to. Maybe they can't remember as good as they once did. They need help with daily tasks. All of these things can lead to depression and a feeling of losing control over one's life. Now add to that a terminal illness that the person can do nothing in their power to change, and they know there is no cure for it. They're just counting down the days until the end. Offering death with dignity to these people gives them one last chance to be in control. It gives them the feeling that even though they can't change the circumstances, they do get to live the rest of their life on their terms. Watching a loved one die is hard, especially if the family is still holding out hope or just not ready to let go. Death with dignity is a great way for families to cope as well. Knowing that their loved one is making this decision when they are in a happy place, surrounded by family, and not suffering is comforting for them as well. These laws allow for life to be celebrated as it comes to an end. In the documentary How to Die in Oregon, it shows people having parties with all of their family and friends to celebrate this wonderful life that they've lived, and it leaves them with happy memories in those final days. Rather than seeing someone waste away in a hospital bed, they have the wonderful memories to take with them and to remember their loved one by. And not only is it important for the person to feel like they have a choice, but it is also important for them to be able to choose not to suffer. The end stages of terminal illness can cause great amounts of pain, and it can lead to the use of many pain medications to keep the person comfortable. Oftentimes, that leaves people bedbound and heavily sedated and unable to be present in their surroundings. The life is simply being prolonged at that point. Services like hospice care are typically used in the end of life to ensure that the patient is kept comfortable. Similarly to death with dignity, they must have a terminal illness with a 6-month life expectancy or less. The problem that I see with hospice is oftentimes people become depressed. They know they're dying and they are just waiting for it to happen. Many times people will say that they are ready to go and they don't want to live anymore. Finding the right balance of pain medication can be really hard. Over time, they will need higher doses of medication to keep them comfortable as their bodies become accustomed to it. With death with dignity, the person has the choice to decide when they suffered enough. They're able to pass painlessly before the disease takes away their abilities to function normally. They don't have to suffer for months and wait for the inevitable. They get to choose to live happily until they are ready to say their final goodbyes to their family and pass peacefully. PatientsRightCouncil.org reports the medication that is given during death with dignity puts the patient into a comatose state shortly after ingestion. Pain is not felt during this time. They slowly drift off to sleep as the medication works to suppress their breathing and their heart rate. They pass quickly and peacefully. A provider will check for a pulse until there isn't one, and then at that time they will call the time of death. Some people may say that this is murder on the doctor's part or suicide on the individual's, but in reality, it's neither of those things. These people don't want to die. They are simply choosing quality of life over quantity. There are many factors that go into being approved and prescribed medication through the Death with Dignity Act. Medscape.com describes the process as follows. A person who is 18 or older must be of sound mind. They must have a terminal illness with a confirmed 6 months or less to live. They then have to make 2 oral requests to a provider to start the process. The second request must be stated 15 days after the first. Along with that, the person must submit a written request that has to be signed by 2 witnesses. Then the person must undergo a psychological exam and be determined to be mentally stable. After all of that, the person must go through the same steps with a second provider. And if at any time either of those providers feel like the patient is not stable, they can send them to counseling or just deny the request. After those steps, the provider is then required to tell the patient of other options, such as comfort care, hospice, and pain management. They must also offer a chance to rescind the request at the time of the second oral request made by the patient. Once the medication is in the patient's possession, they're in complete control of when they choose to take it. They can at any time change their mind, even up until the second that they decide to ingest it. They have to be able to put the medication in their own mouth and swallow it. No one, not even a doctor, can administer it for them. The time from ingestion to death can vary depending on weight, age, and health. On average, it takes around 2 to 10 minutes. All of the different steps and safeguards put into place are really important, as this is a huge decision for someone to make. It's not an easy choice to make, and it certainly is not an easy way out. This takes strength and courage. Everyone may not agree with this act, but we must take our personal beliefs out of the situation and look at the bigger picture. Those who are in this situation to even consider death with dignity haven't taken their decision lightly. Knowing you are dying and not being able to do anything to stop it is such a scary thing to think about. Knowing you have the choice to enjoy your final days with your family and not have to suffer in the end is comforting. Finding any silver lining in a time of grief is enough to give someone the strength to enjoy another day, even if it'll be their last. Anyone that can't understand how someone could choose this option, I would strongly urge you to watch the documentary How to Die in Oregon. It is eye-opening, and it really makes you see the end of life and illness in a different light. You may just change your mind. I'll leave you with this quote, and I think it sums up this speech pretty well. Death is not the opposite of life, but a part of it. That's by Haruki Murakami. Thank you for watching.